The remarkable story of Dr. Leonid Rogozov, the doctor who performed his own surgery. In the vast frozen expanse of Antarctica, where survival depends on resilience and teamwork, one man faced an unimaginable challenge, performing surgery on himself to save his own life. This is the true story of Dr. Leonid Rogozov, a Soviet physician who carried out an appendectomy on himself in 1961, becoming a legend in the medical and survival world. Background: a mission to Antarctica. Dr. Leonid Rogozov was a 27-year-old Soviet doctor who had been selected to be part of the 6th Soviet Antarctic expedition in 1960. His team was sent to establish Novolazarevskaya Station, a research base in one of the most isolated and inhospitable places on Earth. Antarctica is a land of extremes: freezing temperatures, violent snowstorms, and months of complete isolation from the rest of the world. The station was cut off from civilization, with no way for reinforcements or emergency medical aid to arrive during the brutal winter months. As the station's only doctor, Rogozov was responsible for the health and well-being of the entire expedition team. But in a cruel twist of fate, it was his own life that would soon be in danger. The medical crisis, appendicitis, strikes. In April 1961, after months of extreme cold and limited supplies, Dr. Rogozov began to feel severe abdominal pain, nausea, and weakness. His symptoms worsened daily, and as a doctor, he quickly recognized the problem: acute appendicitis. Under normal circumstances, appendicitis is not a life-threatening condition because it can be treated with a simple surgery. But for Rogozov, there was no hospital, no surgeons, and no way to be evacuated. If his appendix burst, it could lead to peritonitis, a deadly infection that would kill him. Realizing he had no other choice, he made a bold and terrifying decision. He would have to perform his own surgery. Preparation for the self-surgery. Dr. Rogozov prepared himself as best as he could, knowing that the operation would be extremely dangerous. He selected 2 of his colleagues, a meteorologist and a driver, to assist him. One would hold a mirror to help him see the surgical area. The other would hand him surgical tools and keep him conscious if he started to faint. He gave both men instructions on what to do if he lost consciousness mid-surgery. For anesthesia, he could not put himself to sleep, as he needed to perform the operation. Instead, he used only local anesthesia to numb the area around his abdomen while remaining fully awake. At 2 a.m. on April 30th, 1961, with the Antarctic blizzard raging outside, Dr. Rogozov began to operate on himself. The surgery: a battle against pain and time. Using only a scalpel, forceps, and a small mirror, Dr. Rogozov made a 10 to 12 centimeter incision in his lower abdomen. The mirror proved disorienting, so he had to work mostly by touch, feeling for his swollen appendix. His hands grew weak, and he started sweating heavily, but he forced himself to continue. At times, he felt so dizzy and nauseous that he had to stop for a few seconds to recover. At one point, he realized that if he didn't hurry, he would lose consciousness before finishing. After nearly 2 hours, he finally managed to remove his appendix and carefully stitch himself back up. The surgery was a success. Recovery and survival. Within 5 days, Dr. Rogozov's fever was gone. Within 2 weeks, he had fully recovered and resumed his duties at the station. His courage and skill had saved his own life. He continued working in Antarctica until the expedition ended and later returned to the Soviet Union, where he became a renowned doctor. His self-surgery became legendary, studied by medical experts worldwide. Legacy: the man who defied death. Dr. Leonid Rogozov's story is one of the most remarkable examples of human determination and survival.